Hello, Dr. James Bogesh, expert in health and longevity, and as a practicing chiropractor who relies heavily on soft tissue techniques, especially instrument assisted soft tissue techniques, this particular article really feeds my bias, if you want to say that, or really just goes with what I've learned and now approaching a full 27 years in practice. But this is a study looking at myofascial release, which is kind of a generic topic or generic title or term that encompasses things like instrument assisted soft tissue technique. That is, some people may call it scraping. Graston is one technique. There are a couple other ones that are out there. Can also include cupping, dry needling. The articles talked about hooks. Not quite sure what that is, but it sounds a little bit less comfortable than some of the other ones. And it compared it to those were basically provider applied, and then it compared it to home applied. So like foam rolling was really the biggest factor there, even though I've certainly been vocal about the fact that I'm a big fan of massage guns. And so this was a meta-analysis or systemic review looking at, they narrowed it down to 16 studies, and what they found was that for a variety of different pattern, these were in athletes, but a variety of different parameters like range of motion, pain, functionality, the piezoelectric effect, but they found that instrument-assisted soft tissue manipulation really kind of won out among some of the other techniques, which again, for a variety of reasons, doesn't surprise me. And foam rolling was also seemed to shine in the different studies that they looked at. The authors talked about it preventing densification, which is exactly what I promote. The idea that acute injuries will become chronic if we don't manage them correctly, and a lot of times that has to do with not addressing the tightness that occurs after an injury or an overuse or something along those lines. And all the evidence currently points to like densifications of the fascia where it starts to thicken up. It's not as pliable as it used to be, and it doesn't move as well. It starts to affect feedback to the brain and how a joint moves, and we have to address those densifications, if you will. Foam rolling can probably be an effective tool, or home massage guns, when applied relatively quickly after an injury. Maybe the first day, first couple weeks, maybe even months, but once something's been going on for a long time, or if you had an acute injury that was never properly addressed, it's going to be harder, and I don't feel that foam rolling is going to be deep enough to address those. For those injuries, you have to be able to get into those tissues and make more permanent changes, and I think that's one of the reasons why the instrument-assisted soft tissue techniques really rose to the top, because it's one of the ways, when properly applied, that you can start making these more long-lasting changes into chronic soft tissue dysfunctions that affect pain and function and range of motion and everything else. So as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.